study conducted by the University of Cape Town and the SA Medical Research Council has revealed the country's COVID-19 mortality rate for 2020 was among the top 5 in the world. The study reports that people aged between 60 and 69 were among the worst affected at the peak of the first wave of COVID-19. Well, let's unpack the study now. We chat now to the Council's Professor David Bradshaw. Prof, a very good morning. Thanks so much for your time. So let's talk about what these findings say. What are these numbers actually telling us?
Good morning, and morning to your viewers. The study we've been doing is a weekly tracking of the number of deaths that get registered in the country, and we've been comparing them against what would have been expected had the historical trends in deaths continued. We've reflected on the total number of deaths that occurred in 2020, and the as you mentioned, the highest proportion of excess deaths occurred in the age range 60 to 69. Because we don't know exactly which of those deaths were due to COVID or other causes, we focused on what we call the excess deaths, the numbers higher than what would have been expected.
And what does that actually tell us? I mean, when we talk about excess deaths from natural causes, because, I mean, we would imagine that at the time of COVID-related deaths, that was being sort of put down as a cause of death.
It probably has been put down as a cause of death. The challenge that we've got is that we can't actually get sight of what doctors have certified as the cause of death, because the system is a paper-based one with manual coding, and the documents are still in the process of being coded. So it's been very important to have this rapid method of tracking, and that's just focused on the numbers of natural deaths and the unnatural deaths.
Okay, so in this time then, just looking at that first wave, and yes, we knew at the time that people in a certain age group were the most vulnerable then. What can we deduce from this then, Prof? Can we deduce from this that in that time what we were fearing was what was happening, that group was the most vulnerable group, they were most affected by COVID-19? Also, what does it tell us then about how we reacted at the time, or how we dealt with this as a country, as a health system?
For me, one of the most important messages is that our vaccination phase 2, focusing on people over the age of 60, is the critical, strategic. That's really important, because the older people are our most vulnerable. So, with all speed, we need to get the vaccination program focusing on getting the elderly vaccinated.
Okay, so it does tell us about the vulnerability of that particular age group, but what other sort of factors came to your attention? I mean, one was age, I would imagine. Gender, location, demographics. Did we look at what role that played in the number of this type of death?
So perhaps one of the surprises has been the in South Africa, the relative gender pattern of the mortality. In many of the European countries, it's very clear that the male mortality rates are absolutely higher than the female. But in South Africa, they're much closer to each other. The difference between rates for death rates for males and females is less marked. Exactly why that is not exactly clear, except it's possible the living arrangements in South Africa, with grannies in particular, kind of interacting more with younger people. I don't think we know what's caused that, but that is a little bit of a surprising observation.
So, Prof, what do we do now with this information? You did say earlier that this can help us going forward in terms of who needs to be vaccinated, where the urgency is. So how do we use this? How useful will this information be to us now going forward?
So I think to target the elderly in the vaccination program is essential. We've also, what it's revealed is the disparities across the country and the actual death rate that occurred in the Eastern Cape once we standardized for age. We can see that it was highest in that province. And that, I think, does tell us that we need to look at the access to health care in the different provinces and make sure all of them are up to scratch.
All right, thanks very much for that insight. Just looking at the numbers, the year that was, Professor Debbie Bradshaw from the SA Medical Research Council.